Introduce Shaikh from the Clinical Research Network, who wants to talk to us about research-ready communities. And I'm hoping that Mo will explain all that to you in his introduction. So I'm going to handle the slides on in the room, Mo. So as you change slides, I'll change slides for the screen show in the room. So over to you.
Okay, Chair, thank you for that. Thank you very much. I hope everyone could hear me. I'm just going to put my volume up a bit as well on this side. Yeah, thank you for giving me this chance to come to the community partnership and talk about research-ready communities. My name is Mo Shaikh. I'm the Patient and Public Involvement and Engagement Cross-Cutting Theme Lead for the Clinical Research Network West Midlands. I've been involved in the NHS predominantly around health promotion, working in community engagement and community development for the last 25 years and working in the NIHR, which is the National Institute for Health and Care Research, for the last decade. So I wanted to kind of share and speak to you all about this new program that we've just recently started, and it's called Research Ready Communities. Next slide, please. So some of you might be asking, so what is the Clinical Research Network? Well, the Department of Health and Social Care set up the National Institute for Health and Care Research, the NIHR for short, in 2006 to improve the nation's health through research. The Clinical Research Network, the CRN for short, now you could already see this is NHS language and terminologies and jargon already, so apologies for that. So the CRN is one of the kind of research organizations within that larger NIHR infrastructure, which supports research happening in the NHS, especially within primary care settings and secondary care settings like GP practices and hospitals, and also now transition towards social care settings, such as care homes and residential care homes as well. The CRN helps people to take part in health and care research studies, but also helps people to have a say about the type of research that's taking place in their local area and how this should be delivered. And our role as the Clinical Research Network is to help provide funding for research support staff, making sure equipment for research and facilities for research is available, and so that research is not subsidized with funding for health and care treatments and services which patients often kind of use for themselves. Next slide, please. So what is healthcare research and why does it matter? Well, I was looking at your agenda earlier, and apologies, I couldn't join earlier because I had to go to a hospital appointment, but I could see the kind of agenda and the discussions taking place around health inequalities, the support around health and well-being within your community. So I'm literally preaching to the converted here. But just to talk about health and care research and why it matters, well, health and care research informs the health advice and treatment we get from our doctors and NHS. By delivering research, it helps us to find out what the best options are available for improving and protecting our health, and we learn how best to diagnose, treat, and also prevent illnesses. One of the things that we realize and we recognize, especially from the COVID-19 pandemic, that health and care research isn't as inclusive as it should be or as it could be. So what we need to do is make sure we include and engage with all groups of the communities around health and care research so that we have a better understanding about what works best for different people and their needs. Next slide, please. In addition, the COVID-19 pandemic highlighted so many disparities within health research and health services in general, especially when you looked at the impact it was having around ethnic minority communities. So as a result, there was a new document that the NIHR published just last year, and it's called Best Research for Best Health, the Next Chapter. And what it kind of really signified was that how research can play a key role in preventing health inequalities, but also how the role of community engagement is paramount to this. what we realize is that people with the highest risk of ill health are often those that are least likely to engage with research or participate in volunteer studies, which then kind of, it doesn't give us the kind of the learning or the actual kind of, the messages around what treatments and what prevention methods we should be sharing within those communities to reach to those communities. What we realize is that as the NIHR, as the large infrastructure that we are, we really need to develop better relationships and trust with our local communities and our local populations. What we really need to do is really strengthen our relationship with the voluntary and community sector if we are to engage with those people who are traditionally not taking part in health research or actually having conversations about what health means in their local communities with us. So what we know is that we need to really develop this, this relationship, and Research Ready Communities is one kind of program that hopes to kind of look at strengthening that relationship and that trust with local communities. Next slide, please. One of the key highlights of the Best Research for Best Health document was it really prioritizes community engagement, and it really highlights its actually value towards the language and the conversations around health and health research. So within the clinical research network, what we do know is that many kind of organizations within the public sector, local authorities, the voluntary community sector use community development and engagement. But within the CRN, we've actually defined it to determine that community engagement uses structured processes and reciprocal relationships to increase research activation within communities. And hopefully this helps community understanding within research organizations. So the two key words here is community engagement and research activation. So what we want to do is develop this community engagement with communities so that it helps people to look at research opportunities, to start to discuss research within their communities. And when there is local research opportunities or studies taking place, they might be comfortable to actually say, actually, I'm happy to take part or actually influence on this research study. Next slide, please. So the Research Ready Communities is a new program. Last year, there was a pilot that was taken within Brixton, Blackpool, and Yorkshire and Humber. And as a result of the successes of this program, they've rolled it out into 15 areas across the country. And in the West Midlands, we want to actually work within the Herefordshire and Worcestershire area. Next slide, please. So what is the Research Ready Communities program? Well, it's a program which helps local communities to find out what health and care research is, how it can benefit them, how to take part in research, and how to get more involved in research opportunities that might be taking place locally. And it does this by training local community champions to talk to people in their community about their views on health and health research. As a result of those conversations, we bring together community organizations, leaders, local services to plan and take some action together in the community to help improve access to research. So what we've done in Research Ready Communities programs is actually introduced a 4-step process to Research Ready Communities. Next slide, please. So the first step for our program, especially around the Hereford and Worcestershire area, is to actually look at and start some conversations with community partner organizations. What we want to do is identify 2 community partner organizations who can identify 1 or 2 community champions in your existing network or setting. What we want to do is support community members to actually come on board who are maybe active members of your organization, active members of the community who are passionate about health equality and making positive change for people in the local area. What we will do is actually provide free training for community champions in September. I've literally just got an email, and it's 2 dates in September, the 13th and 14th of September, where we'll give them the skills to actually be involved in research-ready communities. Next slide, please. So what your community champions will be doing is actually taking part in some training. And as a result, from October to November, they'll be actually talking to local community members. So actually just undertaking some interviews, maybe a set of small questions which they could kind of use with their local neighbors, their local areas, to find out what local people in the community think about health and health research generally. We'll help them organize a workshop at their local community center or a venue where people kind of congregate. And what we'll also do is help them undertake a mapping exercise, which is just walking around the local area to find out where some of those key community places are, you know, where people go for local resources and services. I mean, the earlier presentation about talk community websites was actually really ideal for this. Next slide, please. The third step for research-ready communities is that what we'll do is we'll bring all of that intelligence from those 4 local community champions. So those discussions that they've been taking in the local communities, that mapping exercise, that walking, that local intelligence. And what we'll do is bring community partner organizations, key organizations together, and share those findings with those community members. It might be that we bring all that local intelligence to a forum like this community partnership, and maybe do a small workshop about how we could devise an action plan, a collective action plan, to help to kind of look at some ways and methods that we could increase access to health research opportunities for local community members. Next slide, please. And then what we'll do is from those actions, we'll support you and the community champions to actually implement and carry out those actions. And we'll actually see if we can make some difference in people's understanding about health research and taking up health research opportunities generally. What we want to do is mobilize this research conversation, this research discussion within local communities. So it's not seen as something which is kind of, only experts or academics or clinicians talk about research, but it's like more community members and community organizations feel much more comfortable to talk about research and what research should be taking place and how it should be taking place in the local community. Next slide, please. So what we're doing to go forward and hopefully implement research-ready communities across the Hereford and Worcestershire area is to first of all look at a specific area or a specific neighbourhood that we're really interested to work in. I've been really fortunate to meet some of your colleagues from Hereford and also kind of have a better understanding on some of the kind of inequalities, both locally and health inequalities within those areas. Fortunately, I've met a few members from key organizations, and what we're looking for is 2 community partner organizations who are willing to come on board and maybe work with us to kind of implement this Research Ready Communities program. We have one community partner organization which is really interested to come on board, Age UK. So thankfully, we're looking for another community partner organization to come on board as well from now until the end of August. What we'll do is provide some recognition payment for community partner organizations. We'll also hopefully try to identify 2 community champions from within each of those community partner organizations. So a total of 4 community champions. We'll support them to take some training. We'll support them with travel expenses and to attend training and workshops. And then also some of the recognition payment for what community champions will be delivering in terms of speaking and delivering some interviews in the communities and doing some mapping exercises. We'll provide that as a network. and also the activity costs. So once we've brought all of that intelligence together and we decide about some of those local actions, we could actually help with providing some support towards those actions. Next slide, please. I don't know if we've got time for questions, but I'm happy to take any questions in the chat or anyone from the table, or yeah.
Yeah, so we have
Thank
got
you for
time.
listening.
We have got time for questions, Mo. So
Brilliant.
anybody on Zoom or in the room got any questions for Mo? Hang on, wait for the microphone. So Jan from Taurus.
I'm just interested to hear how you decide which communities to investigate, because Herefordshire is a vast, sparsely populated community, and I'm not quite clear how you're planning to target which areas the community champions will go into. It just seems an awful big county and an awful big task for volunteers.
Thank you, Jan. Really good question. It's an interesting one because every community and every region is very different. So when we look at some of the learning from the pilot, Jan, what they did was actually worked with some of those neighborhoods which has a significant populations from ethnic minority communities. The Blackpool pilot looked at some of those kind of coastal kind of health inequalities and focused in a neighborhood really near some of those coastal areas. I kind of approached some colleagues of ours from the research and development kind of, apologies for that, typical, isn't it? The phone just goes when I'm talking. I approached some of the colleagues from Herefordshire, and what I realized is that some of those inequalities and health inequalities which are present within the inner city areas are very different to a rural setting. So what we kind of did was looked at and spoke to some of those colleagues and to have a better understanding about those kind of communities and those health inequalities. And at this initial stage, Jan, I can't say I'm going to focus in a specific neighborhood or a specific area at this moment in time. What I'm looking for is actually some of those community partner organizations who could actually come forward and say, this is some of the work that we're doing in our area, and maybe the Research Ready Communities program might actually benefit this neighborhood. So at this moment in time, I'm pretty flexible and open. I think it would be wrong for me to kind of decide on a specific area and exclude other areas at this moment in time. And also, Research Ready Communities program is a very much localized approach. So what we do in one area or one neighborhood and trying to make a difference within that neighborhood does not mean to say we can't take some of that learning across Herefordshire and Worcestershire in the future. One of the things that came out from some of those discussions around health inequalities and maybe identifying a potential neighborhood or an area was to look at some of the rural disparities and poverties around digital exclusion, and maybe some of those kind of key elements in terms of health inequalities, which kind of goes across Herefordshire. So what we can do is maybe once we identify the community partner organizations and the champions, maybe work in one area, but the issue that we look at is across Hereford, if that makes sense. So it's I don't know if that answers your question, Jan, but I think it's really open for discussions, and for someone that doesn't live in Hereford and also works in the West Midlands, I know very little about your area, so I'm really keen to learn, and I'm really keen to hear what you have to say and what you think the best approach would be.
Thank you. We've got a question from Mary.
Hiya, it's actually a question from Tracy, but I'm helping with it. We wondered whether there was like a role description or something for a community champion. Would it be something that somebody with a learning disability might be able to do, or would it be something that might need a bit more support, or how much ability, or what sort of people would you be working with?
Thank you for that, Mary. Again, a very good question. We do have a leaflet, which is a role description for the community champion. So I could certainly share that with everyone after the meeting. in terms of the disability, from the pilots, what I realized is that there were people who were actually finding it very challenging understanding English, let alone kind of take part. So what we would do is look at the support that's required for individuals that come forward. So to answer your question, Mary, we wouldn't exclude anyone with those kind of disabilities or learning disabilities. What we do is try to work with them and maybe try to have a much more of a tailored approach in supporting them.
Thank you. So we've now got 2 questions on Zoom. So Jen first, if Jen can unmute and ask her question.
Hello. Yes, I'm just wondering, apart from the fact that this is sort of formally set up with the term research and is something that's going on nationally from what I understand, I just wondered what you saw were the key differences between what you are trying to do and things that are taking place in the community anyway. We had a comment earlier about how this partnership, you know, sort of question about how it differs from other things going on. And certainly as an organisation, we do a lot of research ourselves into our statistics in the community, but also grassroots research, because we're all the time making funding bids and we need that evidence. So I'm just wondering, you know, what you are doing. Is it the national sort of comparative forum that's important here, or what?
Thank you, Jen. I think from our perspective as a clinical research network based in the NRHR, it's really changing the culture about how we kind of interact and engage with local people and local communities. So for us, Research Ready Communities gives us a chance to work with community partners and really understand some of those languages or the lack of language around research is. It's not to say we're actually going to be, you know, coming in and delivering research, which we think is going to be, you know, the right kind of research, because organizations like yours are better suited to deliver that research. But what we want to do is find out how we could support organizations and community organizations to actually promote research. What we know is that when we do promote research as the NRHR and not engaging with the voluntary and community sector, we don't do a very good job, Jen. You know, and you know, when it comes to the clinical research network, local peoples don't actually know who we are. So when it comes to future opportunities or research kind of opportunities that people could volunteer in, you know, hopefully Research Ready Communities is just one approach to start to strengthen that relationship with the community and voluntary sector. For us, also, it's about trying to have a better understanding about what happens and what are some of those issues in local communities. We're so far removed of research organizations that we really need to start to kind of work and start to be talking to community groups, organizations, community leaders, and communities themselves to have a better understanding. I mean, my initial conversation, and it goes back to Mary's earlier point, is I had this idea about looking at some of the data that's available in the public domain about some of those health inequalities in Hereford, only then to be kind of speaking to some of your colleagues to say, actually, Mo, you need to make sure you scratch beneath the surface for that data. You know, that data doesn't just say what it is. So it's really just about learning about what's going on. And hopefully, you know, we don't know if Research Ready Communities will, you know, ultimately after, you know, 9 months say, actually, it opens the floodgates of research opportunities for local people within the NRHR. We just hope it starts to kind of build on some of those conversations.
Thanks, Mo. We've got 2 more questions on Zoom. So can I ask the people asking the question and yourself, Mo, to be as brief as possible, because we've got a bit more to do at 20 past. So I'm going to come to Tricia next.
Oh, hi. Thank you very much. I just want to bring up the point that not all health inequalities are related to poverty. The suicide rate in Herefordshire is quite big, and as the chairperson of Crew's Bereavement Care in Herefordshire, we see a lot of issues, you know, issues around that. And one of the biggest issues, I think, in the suicide rate is isolation. The rural community is very isolated to some extent, and it's historic. You know, many families live within very small family units in the countryside. So I would like just to bring that point up, that it's not all about poverty and ethnic diversity, etc., etc. There are other issues as well.
Absolutely, Tricia. And what I'm already learning is that the Herefordshire community is very different to, for example, where I normally work in the Birmingham city. You know, it's very different. And it was interesting because when I spoke to Christine Price, who's on here, she said, let alone forget talking about health research, people ain't accessing health services, Mo. You know, so you really need to look at talking to people around just generally health. So I'm learning as we're going as well, Tricia. So hopefully I'll learn a lot more from people like yourselves as well.
Okay.
Brilliant. Thank you for raising that point.
So Paul, can I come to you next?
Yes, lovely. I'm using my sign language interpreter, Jennifer. Hi, I'm Paul. I work for Action Deafness. I'm the community hub manager. So Mo, I wanted to ask you, I was looking through your PowerPoint. My concern is with the deaf community in Herefordshire, whether that's deaf people or deaf people with additional disabilities, people who are sign language users, are finding that they're having difficulty accessing services. They're having a really difficult time trying to even get access to services. So my question is, how can we work together to resolve that? How can we work together in the future? Are we able to gather statistics so that we're looking at actual facts rather than anecdotal evidence of what's happened to the deaf community? I wonder if you've had any experience of engaging with the deaf community about this. That's my question. Thank you.
Okay, really good question. From my own experience, I'll be honest, I don't have much experience working with the deaf community, so I have very little knowledge and understanding around that. But I'm happy and really keen to learn a lot more from you and having these discussions. So I'll be really interested to meet with you outside of this meeting to see how I could kind of play a more of a key role in taking this agenda forward. So please. I'll drop you an email after this meeting if that sounds good.
That would be great. Thank you.
Brilliant.
Thank you, Mo. We'll draw a close.